Good afternoon, yours truly, Dr. Pierre. Welcome to another edition of the Dr. React series. We are in the month of June, so I figured, all right, there is no better topic or conversation to have about the men. This is Men's Health Month, Pride Month as well too, but Men's Health Month for sure. And we got to talk about it, right? We are going to go into a month where the focus, hopefully the focus is on the men getting themselves together and getting a checkup, right? Like if y'all don't get nothing from this month, if you have a male friend or family member, and if they gotta look up to the sky to figure out when's the last time they went to go see a doctor, like that's got to be stopped. Like we got to push them ASAP. Now, of course, obviously, I understand, maybe not having a doctor around, insurance. I understand those things there. But if that's not a reason, we do not have an excuse, right, not to be getting ourselves checked, right? Like it just doesn't make any sense. When we talk about, and we can list through a whole bunch of diseases, say, like I said, we're not even going to really hit nothing specific. We are really just going to be focusing on calling the men out and making sure they get themselves checked, right? Because there's a lot of things. I'm going to be posting a lot of videos on my channel this month about some of the myths associated with men and their health, and why we keep dying younger, why we keep dying more, why diseases affect us more. I'm going to be talking a lot about that this month because obviously, month of June. But it's so important because it just starts out with, first and foremost, getting ourselves checked. Like, we are losing the race before it even starts. So before it even starts, and I appreciate you for joining, we are talking about Men's Health Month. We are hopefully calling out the men in our lives, whether it be brothers, whether it be cousins, whether it be fathers, uncles, grandpas, dad, like whatever that is, we are calling them out this month. Because this is the month we get to focus on them. We always talking like no one ever wants to talk about us. This is our month to talk about us. And there's so many different things to touch on, especially when we talk about men's health care, that it's difficult, right? Because you can get pulled into different directions, right? You can get pulled into different directions. Whether I'm talking about heart disease, boom, that's a side. Whether I'm talking about cancer risk, that's a side. Dementia, that's a side. Smoking risk, that's a side. Alcohol, that's a side. Mental health, right? Like I think we should, mental health needs its own pillar of discussion. If you talk to someone, one of your close family members, and you ask them like, hey, you know what? Are the men okay? Right? Like, are the men okay? Like, you just say that. You don't even have to go into detail. Are the men okay? Like, they will be like, you know what? I don't know. They'll hit you with the pause. And a lot of it will start, right? And I'll talk about some of my patients, right? Obviously, we won't name names because you know how HIPAA goes. When we talk about just getting men to the office, right? When we're talking about just getting men to the office, two reasons. You can put in the chat, what are the two reasons that you think a man is likely going to come see a doctor, right? Two reasons that typically will bring a guy to the doctor's office. I'll start with the probably not so obvious one. Well, probably depending on who you talk to. First and foremost, usually they have a friend or family member who is like, hey, you need to go get checked. Like, whatever that is, you need to go. Yeah, someone says, I got to make the appointment and go with them. You need to go get checked. So quite often, I'll be taking care of someone in the office, and their family members in the waiting room, and they'll be like, hey, I'm here in the waiting room, but if you don't tell him everything that's going on, I'm going back there with you. That used to be a very common occurrence when I would see a guy, especially for the first time in my office, and that person didn't know me, and they're just trying to figure out what is going on. It was really because a friend or a family member, a spouse, someone said, hey, you need to go to the doctor's office like ASAP. Like, that needs to change like now, right? Number two, and probably the biggest reason, sexual dysfunction. When a man cannot get it up, cannot perform sexually, they go running to the doctor's office. They go running. But let me tell you how they do it. Because let me show you how bad it is. The issue is bad enough to say, you know what? I don't usually go to the doctor, but I'm going to go to the doctor. So it's bad enough to do that. But once they get to the doctor's office, they start having long talk, small talk after small talk. They're talking to me about everything but that issue. And then right when I'm about to walk out the door, like, hey, doc, by the way, you know what? I'm having some trouble. Like, it's like this secret they got to tell me right before I leave. And that is what usually, that's what usually says, okay, doc, let me break down. And for the biggest reason why is we're a prideful bunch. Like, I don't know. I'm not telling no trade secrets out here. We are a very prideful bunch when it comes to our health and ourselves. So it's no shock, no surprise that when it comes to taking care of ourselves, we are the last ones to do it because we want to make sure everyone is taken care of first. And then we want to tell ourselves we're doing okay. Like everyone ain't doing well, but we want to tell ourselves that we're doing okay. Like I don't need to go see a doctor. And it happens so often that if you don't got that family member, that spouse saying go to the doctor, and if you're not having no sexual dysfunction that's forcing you to come to the doctor, the men run away from us, right? But that's why I love June. I love June because we get to spend this whole month just talking about the guys. We get to spend this whole month talking about the guys, trying to encourage the guys to come to the doctor's office. Like, come to the doctor's office, get yourself checked, stop playing games out here, right? Like, these are just, again, I wanted to just get a quick top 10 diseases affecting men, just so we can kind of get aware of problems we're dealing with. Number 1, heart disease. Number 2, cancer. Number 3, respiratory diseases. This is COPD. This is asthma, fibrosis, those types of things there. Number 4, strokes. 5, diabetes. 6, Alzheimer's. 7, liver disease, because we're, cirrhosis, alcoholic drinkers. Number 7, that's liver disease. Number 8, kidney disease. Number 9, depression and suicide. That falls under that mental health pillar that I talked about. And then just infectious diseases like sexually transmitted diseases, HIV, hepatitis, and that like, right? That falls under all of that. So, and Bob says a good point, right? It's easy to have when you have insurance, right? And I understand that, right? Like, I understand that there's going to be people who be like, doc, I don't even have insurance. And this is why, especially for our healthcare providers, when we're doing education, like I always say, like, hey, there got to be a free clinic around you somewhere. Because there's funds, like the government literally pays to have low income clinics around you. There are people likely doing healthcare around you. If you go to any of your local hospitals, they can give you a list of dates and times when there are free screenings such as blood pressure, diabetes, cholesterol. Like, there are some things to get around when finances, insurance is a hurdle. Because let me be honest, there's a lot of people that insurance is a huge hurdle for getting the things they need to be done. But we're not going to blame the fact that not all the guys who aren't going to see the doctor, it's an insurance reason. We won't be facetious in that type of discussion because that's just not true, right? Like, it just isn't, right? It's one of those things where when we talk about like how do we take care of ourselves, right? Like, we have to take some onus. We just got it. We have to take some level of responsibility to say, all right, what is it that I'm not doing to the fullest extent to make sure I'm well taken care of? Because again, we will pass out the oxygen mask for everybody else in our family and leave. And mind you, we're the ones supporting our family on our shoulders. We'll pass out all of the oxygen masks to the family and forget about us. And then something happens, accident at the job, right? Life happens, you get a heart attack, you get a stroke, something happens, and now this whole family is significantly affected because the pillar of the family, right? If the man is the pillar of the family has went down, right? Because they weren't taking care of their health. Quite often, I take care of patients who they come to see me in the office. First time they come to see me in the office, They ain't see a doctor in years. That's usually the scenario. They do one of these. They start looking up in the eye. Years. I asked them, when's the last time you see a doctor? I don't know, doc. Okay. What medications you have? I'm on no medications, doc. What disease you have? I don't have no diseases. This is what they're telling me, right? And a lot of times, right, I'm going to say I'll say 8 times out of 10. I won't go 10 out of 10. 8 times out of 10. A lot of times the reason why they don't have quote unquote diseases is because no one's ever diagnosed it. They've never went to a doctor to get the actual diagnosis. So boom, here I come. Now I have to turn around and be the bearer of bad news. I had a patient, he was like 50, in his mid 50s. Hadn't seen a doctor in about a decade. I come to see him. He's on no medication. I come to see him. I do my typical lab work, my typical workup that you do for any new patient. Next thing you know, this person has high blood pressure, high cholesterol, diabetes, their kidneys, are looking bad to the point where I got to send them to a kidney specialist because they may need dialysis in a few years. And this is a person where if I could have caught them 10 years ago and educated them on their diabetes, educated them on their high blood pressure, I could have prevented them needing to go see a kidney specialist. But the problem is, for the men, right, we think we're invincible. So we just let things go. We just let things go and go until, all right, I'm done. Right? And we can't do that. And again, I love the month of June. It's half time throughout the year. We get to look back and say, all right, was I really doing all of the stuff I needed to do throughout the year, right, to take care of myself by Christmas time? This is a great time to look back to January. How healthy have you been since January? When was your last checkup since January? When's the last time you made sure your blood pressure was fine? Again, we're talking about no insurance. You can go, most grocery stores, Walgreens, CVS's, these pharmacies will have a blood pressure machine. Be honest with yourself. When's the last time you stuck your hand in the blood? Mind you don't know what your blood pressure is, but when's the last time you stuck your hand just to see, let me see what my blood pressure is looking like right now. We're going buying milk, we're buying eggs, we're buying bread. That blood pressure machine sitting right there. We won't even put our arm in there for a good 5 minutes just to make sure the blood pressure is still doing what the blood pressure is supposed to do. Right? Because we're so busy. We're too busy not thinking about our health because we're thinking about everything else. And it's too detrimental to continue being this way because, again, and I listed the diseases: heart disease, leading cause of death for men, cancer. We talk about prostate cancer, colon cancer on this platform all the time, right? We talk about how they are two of the most, I'm not going to say preventable, but two of the most cancers that if you get them, if we catch it early, your life expectancy is in the high 90 percentile. If we can catch your prostate and colon cancer early, you got a 90 plus percent chance of surviving in 5 years. But the problem is that we don't catch it early. It's because we don't catch the prostate cancer early, because we don't catch the colon cancer early, because we don't catch these things early, guess what? Now I have less options for treatment. Now you have that 90 plus percentile goes down to the 40s and 50s, depending on what stage we're getting it. Right? Again, this is the month of June. Look back to January. Be honest with yourself. How healthy have I been since the beginning of the year? I told myself, I did a New Year's resolution. I told myself I'm going to work out 3 times a week. Did I actually do that? I told myself I'm going to eat better. Did I actually do that? I told myself I'm going to start thinking from a mental standpoint, all right, let me control my emotions, right? Let me deal with my anxiety. Let me deal with my anger issues. Let me deal with my stress management. Let me deal with my depression. Let me deal with all of these things here. I told myself that. In January, I told myself I was going to do that. We're in June, where this is our month. Men's health, this is our month, y'all. Question is, how many of us are actually doing what we need to do to make sure that Christmas comes around and we're not in the hospital somewhere, right? Because you got to meet someone like me because you just had your first heart attack. You just had your first stroke, right? How many people, you just got diagnosed with cancer? How many of us are doing the things we need to do during Men's Health Awareness to make sure that Christmas comes around, right? And we're okay. Right. And again, like I said, I talk about this all the time when I talk about the physical health, the financial health, the mental health, the spiritual health. All of these things got to go down. Right. If these things ain't doing, if you're not knocking it out, all of these pillars, you are not Superman. Oh, Ty, what's going on, bro? How you doing? You are not Superman. If you are not knocking out all of your pillars of health, mental health, physical health, financial health. You are not going to be the Superman that you keep portraying yourselves to be. So we got a whole month, right? This is our month to celebrate ourselves in every which way we can. But this is more importantly our month to start looking at ourselves and say, all right, am I doing everything I'm supposed to do to make sure I got a good Christmas? Dr. Barry said, like, hey, man, like, stick your arm in the blood pressure machine. Like, just see what my blood pressure is. Like, my dad had blood pressure issues. My uncle had blood pressure issues. My grandpa had blood pressure issues. Why would you think you don't possibly have blood pressure issues? This is what I talk to my patients about. I say, man, talk to your family members. Say, hey, what type of medical issues you got going on? Because, like, I know your medical issues could possibly affect my medical issues. Like, what's going on over there? It's a question that quite often when I'm seeing a patient in the hospital, in the rehab, when I was doing outpatient, when I'm seeing patients in all these different levels, you'd be surprised how many people don't know these simple questions. We know family history plays a big factor in heart disease, cholesterol, diabetes, stroke risk, kidney disease, all of these. We know family history plays a big factor, but you ask someone, hey, in your family, like anyone dealing with cancer, anyone dealing with blood pressure issues, anyone dealing with diabetes, and it's like, it's crickets, right? Because they don't know, right? And we're not doing a good enough job talking. So we got, like I said, we got a whole month now, right? We got a whole month to celebrate us in every which way, but we can't do that if we are not the healthiest us we can be. Whatever that is, if we want to be the healthiest that we can be, we have to take advantage of this a month like this, right? Because mind you, let me tell you what's going to happen in July. They're not going to talk about men's health. In August, they're not going to talk about men's health. September, not happening. October, for sure not happening. That's breast cancer awareness month. Breast cancer awareness folks got that locked down. Like we're not talking about the men no more. But this time we get a whole month. Like I said, we even get like this blue like ribbon. I guess that's the color of Men's Health. Like we get a whole ribbon. We get a whole month. Men's Health magazine gonna be posting articles. Everyone's gonna be posting articles. Like you already know that's going down. Because when it's cool. When it's cool to talk about it, they're going to talk about it. So you're going to see a lot of fanfare associated with men and getting themselves done. Right? We're going to see a lot of fanfare around it. Okay? Yeah, we're definitely going to start. Like we are not going to talk about this coming June. July comes around, don't even think it. Don't even men's what? Nah, that ain't happening. Right? So that's why I stress when it is our time, when it is go time, like we got to get on it, right? And what does it start with? It starts with getting the checkup. However you get that checkup, whether you are going to your local health department clinic and you're saying, hey, I don't got insurance, but Dr. Pierre says I need to get my blood pressure in my lab, you go ahead and do that. Whether it's I need to find out when's the next free clinic that's coming around and doing blood pressure screenings and cholesterol screenings and diabetes screenings, I need to head over there on that Saturday. That needs to be done, right? If you got insurance, like go make an appointment. And please don't wait till your family member makes the appointment for you. Go make that appointment with your doctor. Say, hey, doc, I already know it's been a while, doc. Just do it all. Just do it all. Every blood test, just do it all, right? Especially because the men, I know a lot of the men, they're a little squeamish about going to the doctor. Like again, we're big machismo everywhere else, and set when it comes to our health. So when it comes to our health, we start getting a little scary about what we can and should be doing. Just come talk to the doctor, talk to them about everything. There's no point to be hiding stuff from your doctor because your doctor can't help you if you don't tell them everything. If you don't tell them everything that's going wrong with you, every ache, every bruise, every irregular bowel movement, if you don't tell them if you don't do that, we're going to be in trouble, right? Because the doctors can only pull out as much as they can, right? And if you, again, and I talk about sexual dysfunction all the time because the sexual dysfunction, the erectile dysfunction is a big indicator for possible issues down the line. I always tell my men to think about it this way. If you're having erectile dysfunction issues, which essentially is blood flow issues due to the penile organ. If you're having blood flow issues to the penis, guess where you may also be having blood flow issues? To the heart, to the kidneys, to the brain. What do we call that? Stroke, heart attack. right? Like you can end up having like a kidney failure. Like just think logically. If you're having blood flow issues to one part of the body, it's a possibility that you're going to have blood flow issues to other parts of the body. And if you want to take care of yourself, right? If you don't want to have to deal with the erectile dysfunction, make sure you're taking care of your blood pressure. If you don't want to have to deal with erectile dysfunction, make sure you're taking care of your blood sugar. If you don't want to have to deal with erectile dysfunction, make sure you're taking your cholesterol. These are things that just kind of go hand in hand. So you can't just run to the doctor and say, hey, doc, I got some erectile dysfunction issues. Check my testosterone. Yes, testosterone may be an issue, but I can assure you that your doctor, if they're good, is going to check everything else. Because they're not going to let a person who may have, early signs of heart disease walk out their office with a Cialis pill. That's not going to happen, right? That you're not getting that Viagra prescription unless I know your diabetes is under control. Like it is what it is, right? I appreciate. Yes, no, we have to do it, right? This is the month. This is the month that we get to show out on us, and no one like gets to make fun of us for doing so, right? No one gets to say, hey, why are you focusing on the men? Right? If I try to do this any other time, people are going to be talking. Any other time I say, hey, you know what? I only want to focus on men right now. That's it. I'm only going to focus on it. And mind you, for those who follow me, make sure you do. Those who follow me know that a lot of my audience is women. So even when I'm doing the talking that I'm doing now, it's not necessarily directly to the audience who follows me either on TikTok or subscribes to the podcast, subscribes to the YouTube channel. Right? It's so I can make sure that they get this message to their spouse, to their brother, to their uncle, to their dad, to the because I know like if I tell them, they'll go like, hey, Dr. Barry said you're supposed to get your prostate checked, and they're not even doing the finger up the butt no more that y'all used to be scared of, right? We're doing blood tests right now, so go get your prostate checked. What are you doing, right? Go get your colon cancer screening. We got blood tests for colon cancer screenings now. Even though again I have a discussion on that because I always tell people, like, let's say you do the blood test and the blood test comes back positive, you're going to have to get a colonoscopy. So, I always say let's skip the middleman and just get the colonoscopy. But hey, some people want to get the blood test first. Okay, cool. Right. So these are things that we get to talk about this month, right? We get to talk about colon cancer in men. We get to talk about lung cancer in men. Obviously, we get to talk about prostate cancer. More importantly, we're going to talk a lot about just the mental health aspect of it. The fact that a lot of us are depressed, a lot of us are extremely anxious, a lot of us have stress management issues, a lot of us have anger issues, a lot of us have a lot of problems that when we try to, let the world know we don't know how to do it, so it comes out wrong, right? It comes out angry. It comes out all of a sudden, we're wanting to fight people, right? We want to fight spouses, right? Because we don't know how to control our emotions, we don't know how to control our temper, right? These are things that. Like all of these factors need to go down, right? Mental, physical, spiritual, financial, all of these things need to be great if we're trying to be great. And the men I know are always trying to be great. And I tell them, like, if you're trying to be great, when's the last time you got your health? Like, nah, you didn't? Okay. So, and any man who tells me, right, like, oh, it's been years since I was to go to the doctor, first thing I ask him is, oh, so what's your life insurance like? I always ask him that. Like, if you're telling me, right, that you don't really care about your health, I just need to know, okay, what's your life insurance situation? So that your friends and family members don't have to like set up a GoFundMe like when you kick it, right? Like what's the life insurance like? Because if you don't think taking care of your blood pressure, taking care of your diabetes, taking care of your cholesterol is important, I want to make sure that at least you're setting up your friends and your family members to avoid having to use GoFundMe. That's all I want. So if you telling me, doc, I don't need to go see a doctor, I'm perfectly fine, I got no problems, I just want to make sure you got good life insurance, just in case that goes down, like we don't have to like set up no GoFundMe for you. And mind you, let me tell you, I always tell my patients this, it's a little bit scare tactic. Medicine, we do a great job at keeping you here. So don't think that you getting a heart attack means you out of here. Don't think you getting a stroke means you out of here. Don't think you having, to have your foot amputated means you're out of here. No, we do a great job keeping you guys around. So you'll be around and you can't feel the left side of your body. You'll be around and you need people to bathe you. You'll be around, right, and you got one less leg. Trust me, we will do a good job keeping you around. And you're going to ask yourself, man, if I would have just got that blood pressure under control like I was supposed to, like if I would have just took that one medication, those two medications like I was supposed to, I'd still have both my feet, right? Right? Like if I would just do what I needed to supposed to, right, I wouldn't have a stroke right now and I'd be able to move both sides of my body, right? So like just do what we have to do ourselves a favor. If we're not going to do ourselves a favor, let's make sure we do those around us a favor and make sure that you don't put too much burden on them when you let your health like affect their life, right? Make sure, you know what, if you do happen to croak, you got your life insurance check. Your life insurance says, hey, you know what? He never goes see the doctor, but he made sure his life insurance premium was paid to make sure y'all was taken care of. All right, boom. Like I'm rocking with that. Hey, you know what? He didn't want to go see the doctor, right? He had a lot of mental, like he didn't want to go see the therapist. He had a lot of issues, but you know what? You just put me in a home over here. You guys don't have to worry. You can visit me whenever you want. Because you be, and this is, again, we're going to end this right here. We're going to end it. So like, I got to chop in a second. We're going to end it. But like, when I tell you the amount of people, because I take care of people in the nursing homes and long-term care centers, it's a lot of men in there. When they end up there, they're lonely. They are absolutely lonely. No one's coming to check for them. No one's coming to see them. Like it's a wild time out here. So yeah, we just got to do better. That's all I'd be asking for, right? So I'm bringing my boy. So that's it for our Men's Health Awareness Month.